Good day. I'm Larry Gostin. I'm a professor of global health law at Georgetown University and faculty director at the O'Neill Institute for National and Global Health Law. I'm very sorry I can't be with you in Bangkok. I had intended to, but I'm unable to be there. I'm most grateful to you for giving me the opportunity to give you some short remarks remotely. My topic is going to be on the commercial determinants of health. And I'm going to begin by talking about a number of the major commercial determinants of our health, although not all of them, including tobacco and fossil fuels, transportation, alcohol, food, and technology. And then I'm going to move on to the regulation at the national and multinational level of these commercial determinants. And then I'm going to finish off by giving you an illustration of what I call our healthy and unhealthy cities around the world. But before I do any of that, I just want to begin with something that may be obvious, but you have to actually think about it a little while. You can go anywhere in the world. You can go from New York to Buenos Aires, from Berlin to London, from Japan to Bangkok. You can go from Ethiopia to South Africa. And you go to any major city in those places, and you do a 365-degree turn, you're going to see pretty much the same thing in every city. Depending upon whether there's effective tobacco control, you might see an ad for Camel cigarettes or cigars. You'll be seeing something about wine or beer or whiskey. You'll probably see signs for chocolate. You'll definitely see a number of fast food establishments, whether it's McDonald's or Burger King or whatever you might see. And you'll probably find yourself being choked by roads and cars and honking and noise. That's pretty much the life of the urban dweller, no matter where you live in the world. It's not very healthy. It's not very pleasant. It's not very good for our well-being, but that's what basically we are surrounded with. So we're shaped not by this idea that we all have autonomy and free will, but we're shaped by a number of key determinants of health. One is a social determinant and a geographic determinant. We're surrounded by like-minded people. If you were to probably say what is the one major predictive value for our health or our lack of health, it would probably be our postal code. We're also shaped by our economics, what income and economic wherewithal we have, what the economic and social safety net might be. And then we're shaped literally by corporations around the world. Let me begin by saying I'm not one of those zealot public health advocates who's anti-corporations. I'm not anti-business. But having said that, it's important to understand that they shape our lives for the good and oftentimes for the very, very bad and hazardous in ways that may be conscious, but also not very conscious. So let's talk a little bit about the major commercial determinants of our health. And I've mentioned a number of them. I want to dig down a little bit. The one we're all most familiar with is tobacco, of course. Tobacco at one point was ubiquitous, and it still is in many parts of the world, particularly in low and middle income countries. And so as high income nations have developed more rigorous tobacco control, cigarette and other tobacco companies and vaping companies have moved to other parts of the world to try to poison the citizens of that area. But just think back or think at the present, depending upon where you live. Tobacco and smoking used to be an accoutrement of the good life. You would see it in movies, movie stars, athletes. Doctors would pronounce that they're camel smokers or whatever we are. We would have all kinds of rugged symbols for tobacco. And so it's really literally been determining the health of countless millions, if not billions, of people around the world, causing untold harms of cancer, respiratory diseases, heart diseases, and a number of other things. We now pretty much understand that, although it continues in many parts of the world, even with the WHO's Framework Convention on Tobacco Control. Less understood, I think, is the role of fossil fuels. Yes, we understand that fossil fuels are responsible for climate change, but I don't think we really understand the full nature of it. We have governments that are organized based upon the idea of more and more fossil fuel energy. We subsidize corn and other products to try to create ethanol and other things to burn fuels with. Car companies, road transport companies, and others lobby and push us really hard. My dad used to say, and this is really counterintuitive from the way we organize ourselves, he always told me and my children, the car is the enemy. And truly, that's true. We organize all of our life around cars, so much so that it's not just the industry that urges more fossil fuels, more cars, more roads, more traffic, more congestion, more smog. But we as individuals do the bidding of these companies, and we insist because the car, like tobacco and others, have been seen as, an accoutrement of a good life, but also a symbol of freedom, a symbol of hope and autonomy. But it's exactly the opposite of that. And then there's the alcohol industry. The alcohol industry really has gotten a free pass. Most people think, if anything, a little bit of wine is good for you. It's not, by the way, not even a little. And we call people who are against or in favor of alcohol control, party poopers or others. The industry has really told us and convinced us that alcohol is necessary for much of the fun of our life. Just like tobacco used to be, if you look at the movies, when people are really kind of sitting back and enjoying themselves, it's either at home with a glass of wine, in a pub, with the kind of social camaraderie of that. People don't really kind of realize the harms that alcohol presents. I've seen some very credible scientific evidence to show, for example, that the overall harms of alcohol rival, if not exceed, those of tobacco. That might seem shocking to you, but it's true. if you talk about the long-term effects of alcohol, if you talk about alcoholic poisoning, if you talk about violence due to alcohol, the control of alcohol, if you talk about injuries and car crashes, alcohol has a lot to answer for. And yet we advertise it, we promote it as something as an unalloyed good, and the industry has convinced us to advocate for it ourselves. We all know that food is an important thing. We all need food to live. But eating healthily is really hard. It's not hard because of our traditions. Most of us, including indigenous populations, Asian populations, Latin American populations, and others, have had, or African, have had historic traditions of really good food, hunting and gathering, the kinds of fruits, vegetables, pulses, beans, whole grains that much of our cultural heritage has been. But now we've been really shaped by the food industry. And even me, who's really tries to be very, very thoughtful about my food, I can go into a supermarket, if there is a supermarket in your area, and be fooled. It's like a shell game. Basically, all of the unhealthy foods are at prominent levels in the supermarkets. We are gravitated toward them. The food industry knows that salt, sugar, saturated fats of various kinds or another addict us. And it is literally a shell game. You'll see labels that will say low in sugar, which means it's high in salt and saturated fat, or low in saturated fat means it's high in sugar, or high in artificial sugars. It's always hard to find something that's just plain, simple, whole foods. Basically, our diet consists of highly refined starches and flours, salt, sugar, saturated fats, cured meats, all of the things that make us unhealthy. It takes a lot of work to have a healthy diet, all because of the way that the industry shapes our thinking and really guides our purchase choices. We are literally ruled. As a human species, probably more than anything else we can do, we're affected by what we put in our mouths. And we put horrible things in our mouths. And the reason we do that primarily is because of the way that we're advertised, labeled, and sold our foods. And then there's the technology industry. Technology can be a very good thing, but we've now got artificial intelligence, social media that feeds us mis and disinformation. It feeds us mis and disinformation about our medicines, our vaccines. Think about COVID-19 pandemic. There are so-called influencers telling us about nutritional supplements, foods that we eat, crazy diets that we have. I tell all of my students, never diet. There are no good diets. The only good diets is a good lifetime nutrition. It's something like a Mediterranean kind of diet, high in really healthy oils and against trans fats, high in whole foods, whole grains, vegetables, lean proteins and the like. But social media teaches us exactly the opposite about our medicines, our vaccines, our food, and so many other areas in our lives. So let me just pivot now to regulation. Why don't we just let the companies self-regulate? Well, the reason we don't and shouldn't is because companies have an enormous incentive, economic incentive, to drive us to do unhealthy things. And if we give them the opportunity to self-regulate, we will be deceived and we will get something that's less than we need to. So we need really strong regulation. We need good labeling laws. We need laws that prevent them from lobbying and changing the political and legislative environment to create what's good for them rather than what's good for the people. And we need strong, positive legal regulation of what they do that's enforceable and with only one guide, what is good for our physical and mental health. The other important thing is that all of these companies that I talked about, and remember that 360-degree turn right at the beginning of my talk, what we're seeing are multinational corporations. So if you regulate strongly in one country, then they will go to the less regulated environment. We see that with tobacco or other regulatory initiatives. And so we need somehow regulations that span different national environments, including taxation. That's really hard. So we need strong institutions. We need strong coordination in terms of multilateral regulation. And let me just conclude by just a notion about what it's like in the major cities of the world. I often do a thought experiment about, what would we really like if we were really thinking about the kinds of places we would want to live in? What would they be like? Well, essentially, there would be getting up in the morning and turning on the tap and having clean, potable water. They would be going to the kitchen and having safe, nutritious food. They'd be leaving the house and having safe mass transportation. There'd be walking paths, there'd be biking paths, there'd be playgrounds, there'd be parks, there'd be clean air. But in fact, if you go to most major cities in the world, you'll see the exact opposite. You'll see cities clogged with smog, pollution, traffic, unhealthy informational environment, bad foods, alcohol, tobacco. It's making us all sick. It's making us sick physically. It's making us sick mentally. It's making us sick emotionally. We know intuitively what the kinds of communities we want to live in. And the question is why we don't. And the reason is that there's an unholy alliance and an unhealthy alliance between commercial manufacturers who gain profit from making us unhealthy, and then lobbying legislators and government to do their bidding, and influencing consumers to want the products and advocate for the products that make themselves unhealthy. What a life, what a world. We can do much better, and we must, and we know the way to do that. Thanks very much, and again, my apologies for not being with you.